A Blank Children's Hospital is overrun with kids sick with a respiratory illness. Children positive with RSV filled all available pediatric beds earlier this week. And that is true, really, across the country right now. Take a look at these two lines from the CDC. Now, the purple is positive PCR detections and the blue is positive antigen detection. So you saw these last week, but really what you need to see there, the lines are still near vertical. Cases absolutely skyrocketing. And here are the cases in Iowa, also using CDC data. These lines are the 5-week average. The purple PCR detections are rising, just as they were last week. Pediatric hospital beds in 9 states and Washington, D.C. are already above 80% capacity. 5 states, including Texas, are at 90% or higher. Local 5's Khalil Maycock spoke to Blank Children's Hospital about how they're operating with an increase of RSV cases and asks what's next for the pediatric teams.
Around 50% of the children that are currently hospitalized at Blank are hospitalized with RSV or with RSV as a secondary issue.
Wendy Woods, a doctor at Blank Children's Hospital, says their facility hasn't seen this amount of respiratory illnesses since before COVID hit. This virus that usually hits kids hard in the winter has steadily increased over the past week, landing patients in all departments like the emergency room, clinics, and inpatient admissions. Because of this, the hospital has expanded their bed use beyond their normal capacity of 34 to 44 available spots.
We are utilizing all possible areas of our children's hospital and even some areas outside of our children's hospital to house patients. So I would say we are working very strategically to make sure that we can access and utilize all available beds to us.
Wood says if things become so extreme where they can't take in any more patients, they would direct parents and their kids to other hospitals in the area or state. And she says as a doctor who has been in this industry for years, this current situation is surprisingly sad to her.
It is difficult when we are housing a significant number in the emergency department, which decreases our ability to see patients quickly in the ER. You do feel like you're not meeting the needs of your community.
And I did reach out to Mercy One to see their cases for RSV and their capacity. Now, their PIO says she couldn't be specific, but she did say half of the patients in there have respiratory illnesses and half of those have RSV. And she did say their hospital is not completely full, but they still do have some beds available.
Well, there's some comforting news in there, some room still to go. All right, Khalil, thank you so much. RSV is also a risk for older folks. One Central Iowa lady tweeted she is 70 years old and she just tested positive for RSV, saying she has all her boosters and the flu shot, yet it did hit her like a ton of bricks. According to the CDC, symptoms of RSV usually show up within 4 to 6 days of being infected. Now, those symptoms usually include a runny nose, a decrease in appetite, coughing, sneezing, fever, and wheezing. However, it can be different for infants. The only symptoms may be irritability, decreased activity, and breathing difficulties. Meanwhile, the flu is already hitting some U.S. states harder than others. Check out this map from the CDC with the data from 2 weeks ago. Red means high level, while green is minimal. That's where Iowa sits right now with our flu activity really on the low end.